So you want to know how having a baby impacts your bladder control? I am going to tell you exactly the impacts of being pregnant and childbirth have on your bladder and your ability to control your bladder. So tune into this video and we will go through exactly what, how, and why your bladder has changed and why your bladder control has changed, and a couple things you can start doing to improve your bladder control today after you have a baby. So let's dive into this hot topic, and please like and subscribe and share this with all your pregnant friends or anyone that is planning to have a baby or just had a baby. It is really important that we get this information out there because people just assume that after you have a baby, it is natural to pee your pants. And I want to tell you firsthand that your bladder control doesn't have to change just because you had a baby. So let's dive into exactly the changes that occur in your body during pregnancy and what happens during delivery that can affect your bladder postpartum. When you're pregnant and you grow a baby in your uterus, you do that for about 9 to 10 months. Most pregnancies go 40 weeks gestation, give or take a few weeks. And when that baby grows, it grows inside your uterus. Well, let's dive into where exactly this uterus is located. The uterus sits on top of the bladder. So if this is a uterus here and this is a bladder, as the uterus grows and expands, it sits heavy on that bladder. So the bladder has pressure on it for about 9 months. And that pressure can cause the bladder to go down lower and fall into the vaginal canal. This is called pelvic organ descent or pelvic organ prolapse. Now, this happens during pregnancy. You'll get some descent of that bladder on the anterior wall of the vagina. So if this is the vaginal canal and the bladder's here and the uterus is here, as it grows and the vagina is connected to the cervix, the uterus being heavy on that bladder can push the bladder into that anterior wall, causing what's called a cystocele or just a little pelvic organ descent. Now, again, very common during pregnancy, but that can affect our bladder control. Now, that's not the only piece of the puzzle. The other aspect is that the pelvic floor that holds everything up and inside of our body oftentimes gets tighter during the pregnancy itself. So I'm going to show you the pelvic floor. This is a pelvic floor. Okay, so here's a pelvis and this is the pelvic floor. It is 3 layers of muscles. During the pregnancy, our joints get looser. That is from progesterone, that is from relaxin, and it affects the joints of the pubic symphysis joint up here on the front of the pelvis, and then on the back of the pelvis, it can affect the SI joints. Now, it's not just specific to the pelvis, so you might experience more laxity or flexibility in the rest of your joints, like your feet, like your knees, like your neck. And when we have increased flexibility in our joints, our muscles are going to tighten to try and support the increase in flexibility. Well, what does that mean for the pelvic floor? That means that the pelvic floor is going to tighten to try and support these joints as you're growing the baby. Okay, you follow me? So we have the pelvic floor tightening. We have the uterus growing bigger and growing heavier on top of that bladder. Now what is happening? Well, when the pelvic floor tightens, you imagine this bowl is tightening. If that bowl has a grape inside of it, let's pretend that grape is the bladder, the tighter the pelvic floor gets, the more pressure it puts on the bladder. So now you have 2 things creating more pressure on the bladder. You have the pelvic floor tightness creating more pressure, and then you have the uterus creating more pressure on the bladder, which is going to make bladder control really hard, and why you see an increase of incontinence or peeing your pants when you're pregnant. people might experience that they cough or they laugh really hard and they just pee their pants, or they have to go to the bathroom and they just can't hold it to get to the bathroom. And a lot of that is due to the increased tightness in the pelvic floor and then the increased pressure of the uterus down on the bladder. So these are two really serious things affecting the bladder control. Now, there are some ways to help improve bladder control while you're pregnant, and we're gonna get into that at the end of this video. So that is how bladder control is affected during the pregnancy. And then during the childbirth itself, if the baby comes vaginally, what happens is that you typically are going to breathe the baby down and or push the baby down. The longer you push, or the longer that pushing phase lasts, the more pressure is going to be down on the bladder, because then you're not only pushing the baby out, you're also pushing your bladder down and out. And so we want to avoid long pushing phases by prepping our pelvic floor for birth and prepping our pelvises for birth. And we get into that in other videos, so you can check out some of my other videos there, and I'll drop those in the show notes themselves. But for today, just to know that the longer you push, the more that's going to affect negatively the positioning of your bladder. Now, a lot of times you get spontaneous recoil of the bladder going back up to its home, but the longer you push, or the more purple pushing you do, purple pushing is breath holding and bearing down, usually cued for about 10 seconds. That will cause more perineal injury, so more injury or likelihood of tearing to this area. And that can also cause more descent of the bladder, creating what is called a cystocele, a pelvic organ prolapse, that you would deal with after childbirth. But those are some of the impacts that it can have on the actual bladder itself. And so the longer you push, the more pressure and descent that you're going to experience on the bladder. And then after, in the postpartum phase, it's harder to control the bladder if it's lower or past the line of the pelvic floor. So it becomes it's a tricky situation. So I hope you're following all that, because I know it is complicated how childbirth and pregnancy affect the bladder, but it's really important for you to know, because there are some things that you can do to improve your bladder control and improve the possibility that you won't have control postpartum, because we want to mitigate that as best as possible. Now, with that vaginal delivery, if you had any tearing, so tearing would be in this area, in the perineal area. You can have a grade 1 tear, you can have a grade 2 tear, which is a little further, or a grade 3 tear, which is all the way down to what's called the external anal sphincter, so around the anus, or a grade 4 tear, which is all the way through the pelvic floor. Now, the more tearing you have, typically the more tightness that you have after childbirth from the scar tissue itself. So if this is the muscle, then this is actin and myosin contracting against each other, and you have fascia that contracts and moves and glides along that. If we have scar tissue, that's going to bound down, and that's going to prevent the contraction and relaxation of the muscle, making it just a weaker muscle. And typically it gets a lot tighter because our bodies around scar tissue tend to tighten down even more and create a bond that's really deep. It's amazing how the body heals, but then that becomes ineffective, because the tighter we wrap around that scar tissue, the less likelihood we have that we can expand. And all of the strength of the pelvic floor comes from the ability to expand the pelvic floor and to contract, but mainly the strength component and keeping us continent and keeping our bladder in as best control we can have of our bladder comes from the elongation of the pelvic floor and opening up that pelvic floor, which is why it's actually so important to break up that scar tissue so you can improve your bladder control after you have a baby. And the body's amazing at compensating. So you might have okay bladder control for the first year or 5, but then that breaks down and you end up with more issues because you haven't dealt with that scar tissue. So we want to help open the pelvic floor so you get that range of motion, so you can get your pelvic floor working for you in order to help protect your bladder and keep your bladder control as good as humanly possible and keep you leak free. And so that's how childbirth can affect the bladder. Now, equally, if you had a C-section, you will have scar tissue in your belly, and that can also affect the bladder control. A lot of times when we have a C-section in our belly, we have increased tightness in our belly, but that tightness also pulls up from the pelvic floor. So if you imagine I'm wearing a one-piece swimsuit here, and here is my C-section scar, and it starts to tighten, tighten, tighten. It's gonna pull from the top and it's gonna pull from the bottom, further creating tension and tightness in the pelvic floor itself, preventing me to control my bladder because I don't have range of motion of my pelvic floor. So the key to the bladder control postpartum and during pregnancy is to get as much pelvic floor range of motion as humanly possible. And if we get that range of motion, then we can maintain control of our bladder. So how do we get this range of motion? Well, the first thing we can do is start training our pelvic floor to open and relax. So in your postpartum life, a lot of times there's stress, we're holding babies, we're doing things around the house. A lot of times we'll find ourselves clenching our glutes or holding our bellies in. And if you find yourself clenching your glutes or holding your belly in, I want you to try and relax that and open your glutes up and let your glutes relax while you're sitting, while you're standing, while you're holding baby, while you're unloading the dishwasher. No matter the task at hand, try to unhook your glutes, relax your glutes, and that is going to help start to relax the pelvic floor, which is actually going to give you more strength and control of your bladder. So I hope you follow that, and if you don't, please drop a note in the show comments, and I will respond to you directly. We want to make sure that you understand that concept because it can be a very tricky concept for if you're like, I want the tightest pelvic floor possible, but actually that means that that's the weak pelvic floor. So we need the pelvic floor to be able to get tight, but also stay super loose and have that function in the whole range of motion. So that means that when your bladder does get full, then the pelvic floor can then squeeze around it to hold it or relax to fully empty it. But if the bladder gets full and the pelvic floor is really tight, the bladder is going to find a way to leak that urine anyways. And so we want to prevent that from happening, and how you do that is by helping relax and open the pelvic floor. So let's join me right now. I want you to do this to try and get that connection to the pelvic floor. You are going to take a nice deep breath into your belly. You're going to have a hand on your chest and a hand on your belly. Take a nice deep breath into the belly and exhale. When you inhale into the belly, I want you to imagine your sit bones opening and lengthening. You're not pushing like you would push out a baby. You're just allowing that opening to occur. And then as you inhale, you'll naturally feel some recoil. I want you to do this 5 minutes a day, and that will help give you improved bladder control because it's going to give you more range of motion of your pelvic floor. And again, the key to the bladder control during pregnancy and postpartum is to get that range of motion. Now, if you are still pregnant and you are struggling with bladder control, I want you to do this breathing as well, because the more range of motion that you can get of your pelvic floor before childbirth, the easier your pushing experience can be. And we want baby to just slide through and be able to get out of the birth canal, and the uterus is what should be pushing the baby down and out through the birth canal, and not you having to forcefully push. So that is a big misconception, is that we push the baby out. And yes, our uteruses push the baby out, and that is really important. But we need to be able to relax and open our pelvic floor so that the uterus can do its job. But when pelvic floors are really tight and really shortened, then you will find that we're having to, especially if you go to other people's labors, or maybe you've experienced this yourself, you'll find that you have to push and bear down for hours and hours because the pelvic floor isn't dynamic enough to just relax and get out of the way for the baby to just come through birth canal. When it can just relax and get out of the way, we have decreased tearing and we have decreased descent of our bladders. So I hope you found this video educational, and I wish you all the best in your bladder control journey during pregnancy and post childbirth. Take care.